In a frog, if one were to trace the circulatory route starting in the sinus venosus with deoxygenated blood and traveling through the legs and back, the blood would travel to the right atrium, to the single ventricle, to the conus arteriosus, to the pulmocutaneous artery, and some would go to the skin. That which was traveling to the lungs would travel through the pulmonary artery, to the pulmonary capillaries where gas exchange would occur and it would become oxygenated. This blood would then pass into the pulmonary vein, the left atrium, the single ventricle, the conus arteriosus, and then would travel through one of the two arches of the aorta. There are two systemic arches, one on each side. Mammals only retain one of the fetal arches of the aorta. These two then fuse to form the dorsal aorta, which in the region of the hip will split into the two iliac arteries, to the femoral arteries, and other arteries in the leg, such as the sciatic artery. In the capillaries in the leg, gas exchange occurs, and the deoxygenated blood then travels through the femoral vein to the iliac vein, at which point there are two possibilities. The blood could travel through the ventral abdominal vein to the hepatic vein to the sinus venosus, or it could travel to the renal portal vein to the kidneys, which then drain into renal veins into the inferior vena cava to the sinus venosus. Once again, unlike mammals, there are two systemic arches which then fuse to make the dorsal aorta at a midpoint in the back. And there are two alternate routes back from the leg. One route travels through the ventral abdominal vein, which is along the ventral portion of the body cavity, very superficial. It will pass through the liver and then fuse and form the hepatic vein, which empties into the sinus venosus, while other vessels will then fuse to form the renal portal veins, which drain into the kidneys. From the kidneys, then renal veins will drain into the central inferior vena cava, or post cava, which fish lack. Amphibians were the first vertebrates to develop this vessel, which will then take the deoxygenated blood to the sinus venosus.